Hey guys! So I am finally home from the hospital. I am feeling okay. I'm getting there. I'm feeling a lot better than I did last night, but I want to thank you guys so much for motivating me and supporting me and for all your positive comments and all of your encouraging messages. I literally was sitting there in the hospital and reading all of those just made me so much stronger and made my mindset so much stronger. Like, I'm doing the right thing. This is what I want to do. And I want to be an example for women all over the world that this surgery is okay to do at such a young age. It's very important. I was talking to the doctor, the surgeon, before I went in for surgery, and she did say that women who do test positive for the BRCA gene tend to get breast cancer earlier in life than someone who doesn't, usually in their 30s, 30 to 35 years old. So I'm 25. I had a couple years left, she said, if I didn't really want to do anything, but I would have had to do something soon. So I'm glad that I got this over with. I'm glad I got this done now. I didn't give cancer a chance. I stayed strong with you guys by my side. Thank you guys so much. I can't express how thankful I am to have you guys here with me. So I just wanted to go over my hospital stay with you for the past couple of days of kind of what I went through and what's kind of happening now and, things like that. So first, when I got to the hospital, I made a video before I got there, and I ended up seeing the surgeon. And I am going to show you a picture because they did have to mark my chest. I'm not exposing. It's just a picture of my chest. I'm covering up the nipple part of my chest. If you guys don't feel comfortable looking at this image, then you guys can either turn away or you can shut the video off now. I really want this to be educational. I want you guys to learn as much as you can, and if you plan on getting the surgery or thinking about getting the surgery, I want you to know and see everything that I went through and what to expect. So I am going to show you the picture on my phone of what it looked like when they marked me. It's where they're going to do the incision lines and all that stuff. Actually, right now you can see the remnants of where they marked me. You can see an X here, and then the line down here, and then you can see an X right there. So I am going to show the picture now. It kind of just looks like a drawing from a cartoon. But again, if you guys don't want to see it, if it's uncomfortable for you, you guys can go ahead and turn it off. So this is what it looks like right here. So that's how they marked me. They just took a marker and marked underneath my breasts, in the midline, and on top. And the two X's on top notify them that we are doing both of the breasts during surgery. So that was before I went in. So I got all gowned up and I went into the operating room, and the anesthesiologist had gave me the option to have a nerve block. And the nerve block is they put 2 injections in while you sleep, while you're out in the anesthesia. And it kind of numbs the whole chest area for a pretty long time, and it helps with pain control. And I recommend that any of you guys who are opting to get the surgery, definitely get the nerve block. It helps so much with your pain. When I got out of there, I was so comfortable in the recovery room. I had warm blankets on me. I was just a little sore. I had my pain pump. My dad was sitting by my side. I literally was so comfortable, and I couldn't be any happier. And I just wanted to show you, they do 2 injections. I hope you can see the site here. But right here, you can see that's where they did 1 injection. And then on this side right here, they did another. Sorry, my voice is still kind of raspy from the tube being down my throat. That's kind of one of the side effects. Your throat is kind of dry, so it's important that you guys drink lots of fluids after. But after recovery, I went up to my room and I was kind of out of it. The anesthesia makes you loopy and the pain medicine, you just kind of feel blah. But I was so excited that everything was over and I really wanted to show you guys my dressings. So that's when I made my little video at 2 o'clock in the morning. I was getting woken up like every hour by the nurses and the doctors, but I didn't care. I was like, go ahead, do what you have to do, check me out, make sure everything is good. Now, one thing to consider with this surgery is obviously there are complications that can happen. There's infection, and then there's a 30 to 35% chance that the blood supply to your nipples can not be as well, and the nipple can die off. Well, during my surgery, you have to agree to those risks. They can happen. I think that this is really important for me to mention because I'm just, like I said, I'm not ashamed of anything. I want to put everything out there, and I don't want to sugarcoat anything. I want to be real with you guys about my experience. My experience could be different from anyone else's. Just what I went through doesn't mean it's going to happen to you. But I guess after surgery, when they cut the breast tissue out, they want to get as close to the nipple as possible because you want to take as much tissue out as you can so cancer doesn't have anywhere to grow. So on my left side, my left breast, they shine a heat light to see the blood supply, and it was really good. But then on my left breast, they shone it on my nipple, and it wasn't as great as the left side, so they were just going to keep an eye on it. But the surgical team came into my room around 5:30, and they looked at my nipple, and I want to say like a little bit of my nipple is a darker color. It looks more like of a bloody color, like a dusky, like it is kind of, I don't want to say declining, but I guess it is kind of dying off. And it's just a little piece. I'm not really comfortable showing my nipples online for the world to see, but I just wanted to mention, to you guys that the doctor did look at it. She said that it's an area, it's probably just going to scab over and just kind of fall off as a scab. It's literally like that big. It's not even that bad. So she's not concerned about it. I don't really care. I don't even care if I have nipples or not. I'm just happy that the breast tissue is out and that cancer has nowhere to grow. So I do have the expanders in right now, and after I think the first day I was out of surgery, they want to transfer you from the IV medication over to the oral medication. So that, I think, was the hardest part of my surgery because your body is getting pumped up with the anesthesia. You're feeling good. You have the, narcotics in you. And then all of a sudden, like, you stop that and you have to transfer over to the oral. And the oral medication obviously isn't that strong. It takes a little bit more to get into your system, more time. And I definitely had a rough night last night. I couldn't get comfortable. Over on the sides where the drains are hurts the most. I can't wait to get these drains out. And I just want to let you guys know, like, yes, last night really opened my eyes to, like, wow, like, this is a very intense surgery. They did a lot of manipulating. They did a lot of work in you all at once. And it is painful. It is. And I know in my video I said, oh, it's not that bad. It really is. It's just sore, but the soreness can be very overbearing at times, especially if you move a certain way. If I lift my arms a certain way, you can definitely feel it stretching. When I maneuver myself in a chair, I can't push down and maneuver myself. I can't put any weight basically on my arms because it just hurts and it tugs and it pulls. I did show you guys my drains. I am going to do a video tomorrow. I really want to take my binder off just to let you guys see the dressings of the incisions underneath and the dressings of the drains on the side, because I really think that is very important. But I really want to express to you guys that this is a very tough surgery and you really mentally need to be prepared for it, because I almost had a couple times where I was ready to like break down because I was like in so much pain, and I was like, oh my God, like I know I'm going to be in pain, but like sometimes it's just, you know, mentally like, oh my God, like what did I do? But I know in the long run, this was right for me. I'm staying strong. I keep saying in my head, I'm not giving cancer a chance. I'd rather deal with the pain now, even if it hurts, than deal with cancer in the long run. So it's totally worth it. Right now, I am sore. I'm doing well. Definitely helps to get up and move around. I can't stay in one spot too long because everything gets stiff. There's certain positions I can't stay in because I get stiff and it hurts. So um, it's pretty intense. It's a big surgery, especially with the pain and stuff. So just want to let you guys know that I'm doing very well. I have Kevin here to support me and my family here to look after me. They're great. I am going to, like I said, do another video tomorrow, and I'm going to show you my drains, and I'm going to talk more about the drains and the dressings, and show you kind of go more into detail about that stuff, you know, because I think that's important. That's the next step and what you really need to monitor as far as the dressing wise. So I am going to go rest, go get my sleep, and I am so excited to make this video to let you guys know I'm doing fine. If you guys have any questions, like I've had visitors come up and I have shown them my breasts and everything. It's a really good experience. It's a really good opportunity to look and to see what it's all about. So if you guys have any questions, anything, ask me. Nothing's too personal. If you guys want to see a picture, that's totally fine with me. So just let me know. I'll have my phone on me all today. Go ahead and text me, send me comments or whatever. So I will see you guys soon, and I'm going to make another video tomorrow, and I will kind of go more into detail about all the dressings and drains and all that stuff. So I'll see you guys later. Bye.